Hello everybody and welcome back to another video. This is actually the first Therapeutics 2 video on the channel. This video is about TPN. I had a few people message me questions about TPN or ask me about the math. And while traditionally I have my flashcards for Therapeutics, I know since TPN is so math heavy and that's going to be a fair portion of the exam, that I would create a couple cases that would kind of go over how to solve the math and to work through problems like this. So what I've done is before each slide of me working it out, I just posted the case. So if you wanted to try and work ahead of me or figure it out before I show the solution, you could definitely do that. Also, I made these cases a little bit difficult, just in the sense that I don't know the level of difficulty will be assessed on the exam. And especially with the first case, I think there's more than one right answer, and I'll kind of explain what I would look for if I were grading this. But yeah, with that, let's get into it. So for the first case, patient LF is a 50-year-old, 75-kilogram female who is admitted with severe burns on the face and abdomen. The medical team was able to successfully set up an NG tube despite the burns and wants to begin nutrition replacement as quickly as possible. LF has a past medical history of diabetes, hypertension, cholesterol, and heart failure. And then what is the most appropriate treatment option for LF's nutrition deficiency? So when looking at a problem like this, what are the most important things you want to look for? The first thing you want to look for is the weight, which it looks like I actually did not include on this slide as I was editing it, which is kind of funny. But if you remember from the previous slide, it was 75 kilograms. So this is the first thing I'm always going to look for, whether I'm doing enteral, parenteral nutrition, is the weight, because that's kind of what we base everything off of. The next important thing is I'm going to look for kind of the type of disease state, I guess you could call it, that we're trying to treat nutrition for. So in this case, we have a burn, right? And if you look at our chart, burn is usually our heaviest requirements in terms of what we need for treating both in terms of calories and in terms of protein. But the last thing I would look at least from like a problem perspective, are the comorbid conditions or other information. In this case, we actually have a heart failure patient, which makes it a little more challenging. Now, in real life, right? Well, let me first explain why heart failure makes this more complicated. Um, Heart failure, we actually give less fluids to. So you can see our normal fluids are 30 to 35. But in the case of chronic heart failure, you'd only want to give 20 to 25. So lower fluids. The reason for this is because you don't want your patient to have edema, right? You don't want that fluid buildup in the body. If a person has burned the majority of their body, realistically, you're probably going to give more fluids, probably even more than 30 to 35, just because dehydration um, is next to infection, I believe, the number one cause of death from burns. So this isn't a perfect case, but I did want to go through it in this kind of hypothetical scenario, just in the sense that I could kind of show off how you should be thinking about these types of problems. But anyways, with all that, we have our three main pieces of information we want to look at, right? We know it's a burn patient, we know they're 75 kilograms, and we know they have heart failure. And we're just going to pretend like we don't need to fluid resuscitate them more for their burn. So the first thing we need to do is we're going to find essentially how many milliliters of our fluid we're going to give them. This is what you're almost always going to do when you are doing like enteral nutrition, especially when you have like a pre-made bag like this. You could technically also make like a TPN bag for enteral nutrition. You just really shouldn't. There's no point for it, right? Because the whole point of kind of parenteral nutrition is to really customize a patient's regimen to their needs. Which in this case we don't, since we got the NG tube placed, right? It's just going into their stomach. They just need to be able to absorb. They're not burned on the inside, so they'll be fine. So the amount of fluid is always the first thing I look for when doing an enteral nutrition. So we have a range. We have 75 kilograms times 20 to 25 milliliters per kilogram. And with that, we get a range of fluids we can replace. And we get between 1,500 and 1,875 milliliters per day. Right? And we could realistically pick either of these numbers. I'll show you which one we pick eventually, just due to other circumstances. Next thing we need to consider is the amount of protein we need to give them. just because proteins are a little more important than calories, especially in a patient like a burn patient, right? Protein is like the building block of our body, and if we've just burned all that away, while calories are important, protein's going to be a little more important, especially just since we can get calories from protein as well. So we really want to maximize protein wherever we can. And for burn, it's their highest requirement, right? We have that 2 to 2.5 grams per day. So we'll do 75, and then this is also based on kilograms as well. 75 times 2 to 2.5 grams per kilogram. And we get a value of 150 to 1875 or 187.5 grams per day. Now, the final thing we want to look at are total calories. You can see our burn calorie requirements are also really high. So same kind of process, right? We do 75 times 35 to 40 kcal per kilogram. And we get a range of 26-25 kilocalories up to 3,000 kcals per day. Now there's 4 types of like pre-made bags, right, that we can use for this kind of process. We don't need to memorize these, luckily, and I think we'll be given a table similar to this on the exam. So what are we looking for when we look for this? Well, essentially everything we give, I'm getting ahead of myself, actually, sorry. We're going to be looking at our total, like, calories and protein, because the nice thing about these tables is they're already in liters in milliliters. So we basically just have to pick a fluid amount, right? And that'll be somewhere between our 1500 and 1800. So I'll start at 1500 to be conservative. If we do, let's say 1500 times 1.2 for this first one in terms of kilocalories total per milliliter, we get 1800. Now you can see right away that this 1800 is less than our 2600. That's all the way down here, right? So realistically, at least for fiber source HN, we would never use a 1500 milliliter bag. So we can try instead with 1875 milliliters. So if we do 1875 times 1.2, we get 2250, which you can see is still also less than our 2625. So this is good and bad, right? Like, we can't use this bag at all, but at least now we know that fiber source HN really isn't a viable option for what we need to do. So at least for this problem, we can just kind of exclude it from our list. Even with our biggest amount of milliliters, we'll never be able to use it. On the same note, for isosource VHN, this is only a factor of 1. This is only going to be 1875 calories max, so we can never use isosource. These are lower calorie feeds, which can be good for some patients, but just due to how severe our patients' nutrient needs are, you're not really going to use them. So now we're between Novasource and Novasource 2.0. So instead of looking at calories, I want to look at protein for this one, because these are the same in terms of calories, right? These are equally as optimized. They're not going to show us anything different, because they're both 2. So what I want to look at instead is their amounts of protein. So we have 90 for 2.0 and 74 for Novasource renal. So knowing our protein requirement of 150 to 187.5 a day, we can do our 90 now times, not 1500, because this is a little confusing. Instead of being in milliliters like this one was, this was in liters. So it'd be 90 times 1.5, which would get us 135. And if this wasn't clear, this 1.5 was 1500 milliliters. So 135 is below our minimum daily protein requirements, right? So we probably wouldn't use well, we could kind of exclude 1500 milliliters really forever, just in this fact that since this is the higher protein bag, right? If the lower volume of fluid that we can have in our range is lower than the lowest amount of protein, we're just never using that volume, like at all, for at least these types of feeds. There might be more types of feeds out there that would be viable for a 1500, but due to like all intents and purposes, we now know that 1500 milliliters will never supply enough protein for our patient. So we can pretty much cross this off. We don't need this anymore. We're just looking at our 1875. So now what we can do is we can go back with that 90. We can instead do 90 times 1.875, this being our value here, our higher end of our range, and we plug that into our calculators, we get 168.75 grams, which is in our range. This is between the 150 and around 190 that we need, the 187.5. So we could do 1875 milliliters of our NovaSource 2.0. Now let's test it for our NovaSource renal, right? Which we don't really need to do. We could just pick this bag, but we might as well look at it anyways, just for practice. So we have 74 times 1.875, and we get a total protein of 138.5. This is lower than our lowest value, right? So we can never use NovaSource renal. So this makes the answer look pretty clear, I would say, right? We've kind of eliminated the other options. There's one last thing though, one last kind of caveat. I believe if I remember correctly, yeah, so we have our total volume now, right? We're going to go with our highest volume because that's what worked for our proteins. We have 1875 milliliters, and for our calorie requirement, we're going to give them 2 kcals per milliliter. When we do this, we actually get a total of 3750 kcals per day, which is not ideal, right? Because we wanted our max to be 3000. So now what do? There wasn't a single product on this list that fit all the requirements that we needed. And this is where I think the clinical judgment comes in, right? I would say I would still pick NovaSource 2.0. And here's why. Like I mentioned before, in a burn patient, we're mainly looking that they can repair their body, right? That they're getting the proper amount of fluids, which personally I would probably give more fluids than 1875 a day in general, although you could also do like saline without their nutrition, right? There's other ways to accomplish that, so we don't technically need to do that in the feed. I also think going higher on calories is always safe for something like a burn, just in the sense that, again, repairing your body takes energy. And while, yes, you're in the hospital, and if you were a normal patient, you might gain a little bit of weight doing this regimen, you really want those macronutrients just to help your patient. And then also, there's nothing even to say that you can't, per se, switch your formulation later if the patient is gaining weight too quickly. It's just, in the meantime, I think NovaSource 2.0 is the best answer. And I think what you want to do is you want to have about 1875 milliliters per day of that. Okay, so for the next case, patient SB is a 75-year-old 80-kilogram male who was admitted to the hospital due to persistent vomiting. It is determined SB has a severe norovirus infection. While the infection is being treated, the physician orders parenteral nutrition due to the inability to keep food down. SB has no relevant past medical history, but his labs indicate he currently has an SCR of 2. Okay, so to do this next case, what are we looking at? Well, the first nice thing that we have is no past medical history, right? So we can rule out chronic heart failure and renal failure, which is nice for our fluid requirements. Something else, right? No hemodialysis, no CRRT. So this makes our life easier. I would put SB in the category of critically ill, just because mild in there, right? He's vomiting a lot, but he's only got a viral infection. It can be treated. Really just getting his fluids back up, making sure he has nutrition, what we're doing now is important. So yeah, both for calories and protein, I think critically ill is a fine category. Where this gets a little more complex, though, and you might see it's the only thing I didn't cross out. So we have to account for AKI. And the reason for that is because I put serum creatinine of 2 in the problem. Um, since he has no past medical history, we can assume he probably doesn't have CKD, right? It could just be due to low fluid status from vomiting. So we need to run a calculation for eGFR. I'm not going to do that because I already know the answer, but you should. Anyways, if you want to pause the video and then afterwards I can tell you the answer, or I can just tell you right now. It's 36, right? Milliliters per minute. So he's pretty severely impaired right now just due to the low fluids. Meaning, to dose his protein correctly, we do need to do acute kidney injury protein requirements. And you can see that range actually has a slight overlap with our critically ill range, right? So you have 1.5 to 2 here and 0.8 to 1.5. You can definitely do that. In fact, I believe the way I solve this problem, I end up doing that, just picking the 1.5. It's a little bit different per patient, but I'll show you in this problem why it kind of makes sense to do that. In other problems, it might not, but at least for this one, the 1.5 is fine. So when building a bag, right, from scratch, what do we need to think about? The first thing I like thinking about, whereas the previous problem I like thinking about fluids, is I like thinking about calories. I like budgeting calories. Um, which in the case of a critically ill patient is 25 to 30 a day. So we have 80 kilograms, right, times 25 to 30 kcal per kilogram. And if we do the math on that really quick, we get 80 times 25, which is 2,000 to 30 times 80, 2,400 kcal per day. Now, realistically, it doesn't matter which one of these we choose. I think I'm going to choose 2,400, right? Since this is a daily thing, if you were to divide 2,400 by 24, you'd get 100. So you could just have the rate be 100 kcals per hour. Or think of it in that way, even if you would never write it like that on a script. But I think that's fine for this patient. I'm not too worried with a value like that. Now, 2,400 is essentially going to be our budget, quote unquote. Right? We have this value, and we're trying to get dextrose, proteins, and lipids within this value. And what I just kind of bracketed are things we need to remember. Ideally, we want our dextrose to be between half and 60% of our daily calories. We want our protein to be between 20 and 30% of our daily calories. And we want our lipids to be between 10 and 20%. And you can see here there's some max values, like there's no more than 7 grams per kilograms a day of dextrose. Same with proteins and lipid, right? 2.5. Realistically, if you're within these ranges, these percent ranges, you're never going to exceed these in the first place. But it's something to note, right? And then something else is, I want my final answer in my bag to be in grams. So this is kind of an extra step, but I'll show you how to do it. So we'll need to take into account there's 3.4 calories in each gram of dextrose, there's 4 in each gram of protein, and there's 10 in each gram of lipid. You technically wouldn't have to do this if you were writing, well, maybe you would. If you were like making the bag from scratch, you could and you were telling a tech to put these ingredients in it, you could do that. But if you just wanted to know the relative calorie content, you might not need to do that. But regardless, I'm getting ahead of myself. We have our budget of 2,400. So let's start with protein, right? Protein's always what we like to start with. Even if dextrose is the majority of the bag, protein is just such an essential thing, especially in this problem with the AKI, that it's what I want to find first. So if we have 80 kilograms times 0.8 to 1.5 grams of protein, we get that realistically we can give our patient between 64 and about 120 grams of protein per day. Now, this is all well and good, right? But to me, those numbers don't mean anything, right? It's like I could stick protein in a bag, but what are we shooting for here? And that's where these percent ranges come in. So what we have to do is we have to find the amount of calories these grams will give us. So how do we do that? Pretty simple. We can do 4 kcal for 64 to 120 grams of protein, and we get between 64 times 4, 256, and 120 times 4, 480 kcals from our protein. But even that doesn't mean anything, right? Like we have a certain chunk out of our 2400, but what does it mean? So what we can do is we can actually take our 256 over 2400. I'm just going to guesstimate this. This looks like about 11% to me. This is not in our range, so we don't really want to go on the low end of this protein, right? We don't want our 64 grams. Let's try instead our 480 calories over 2400. This is much nicer because this gets us exactly 20%, which is funny because it's the highest range we can give our protein, right? It's that 1.5, but it's the lowest range we can give a protein in terms of calories. It's that 20% right here. So we might as well just go with it, right? We might as well give all 120 grams of protein, which will give us 480 kcals. So let me just write that down. So we're choosing to have 120 grams of protein. So we can subtract our 480, which is 20%. What we're left with is 400 minus 480, 1920 left to work with. Now, I'm going to do lipids next. It doesn't really matter if you do lipids or carbs first. I'm going to, since we were so low in protein, is personally I always try and max out lipids to that 60% or whatever the highest value you can make it is. But since our protein was so low, I'm going to do 20% for lipids. That way we can do 60% for dextrose when we get to it. So we know that if 20% of our calories come from lipids, times our total calories were 2400, we get 480 of our calories would have to be from lipids as well, which makes sense, right? We just saw protein was 480 calories and it was exactly 20%. So realistically, I didn't need to do that math there. I just wanted to show it for completeness sake. But now we can subtract another 480, which is 20% of our 2,400. And this will get us down to 1440 calories that we have left to work with. And alternatively, right, this is like 60% of our total. You don't technically need to write these percents near it. I just like doing it to show it off. If we know that 60% of our calories, because that's what's left, need to come from dextrose times 2400, we get that 1440 as well. So now what do we do with these numbers? Well, we already know we have 120 grams of protein in this bag, right? We know physically how much we need to put in, but we don't really know how many lipids and how many dextroses we need to put in. We know how many calories worth of them we need to put in, but we don't know the physical quantity we're putting into this bag. So what we can do is we can take our 1440 calories of dextrose, divide this by 3.4 kcal per gram, and when we do that, we get, in this bag, we'll need to put about 424 grams of dextrose. For our lipids, we have 480 kcal divided by 10 kcal per gram. And if it's not clear where I got these numbers from, it's 3.4 kcals per gram of dextrose or carbohydrates and 10 kcal per gram of lipids. When we do that, we get 48 grams of lipid. So what does our final bag look like? Well, in terms of carbs, proteins, and lipids, we have respectively 424 grams, 120 grams of protein, 48 grams lipids, and if you remember from the very beginning, I just picked the 2400 milliliter bag, wherever that was. That was around here somewhere. Anyways, I just picked the bag, 2400 ml. Did I do that math? I know I did that math on the side. Let me just do that again, just in case I forgot. Sorry if I'm repeating myself. Yeah, we need to give fluids, right? So 30 to 35 a day, 80 times 30, it's 2400. Then 80 times 35 is 2800. And I just picked 2400 because you can do that right, you could do 100 milliliters per hour. It just makes your life easier. It doesn't really matter. So in 2400 ml. And with that, I know that one was a little bit longer, but I think this one's a little more straightforward, right? Just because you're essentially giving yourself that budget and you're just subtracting off. Really, the only complex part here was the AKI factor, but it was nice that it had an overlap with our critically ill, which just allowed us to find out pretty much exactly how much we needed. And with that, good luck in recitation and on Tuesday with the exam.